These are all the medications you do and don't need for high altitude climbing, when you should take them, and what I personally take when going above 6 or 8,000 meters. First is the most popular, acetazolamide or Diamox. It basically reduces the amount of CO2 in the blood, and you should take it at least 24 hours before going to high altitude. Some purists call it cheating, but it's really not, and you shouldn't always take it. It's a good idea to experiment with it before you go to high altitude for maybe 1 or 2 weeks at low altitude if possible, but it's also something you just don't have to take it all. Second is boner pills, Tadalafil and Sildenafil, better known as Viagra. They are used for treating high altitude pulmonary edema, buildup of fluid in the lungs. They should be in a first aid kit, and you should just take Tadalafil because it's fast acting and forget about Sildenafil. Next is Salmeterol, which is a bronchodilator. It's inhaled. You should use it for HAPE, but not for the treatment, only for prevention. Next is Nifedipine. You should use this with Tadalafil for prevention or treatment of HAPE. It basically relieves the blood pressure by lowering the blood pressure on the lungs and stopping high altitude pulmonary edema. Next is dexamethasone. Methyl. It is used to treat HACE. It's a powerful anti-inflammatory steroid. It reduces brain swelling, and you should only take it really as treatment for AMS, acute mountain sickness, or cerebral edema HACE. You should take really only before you're about to go down. You shouldn't take it while you're going up. Some people do, but anecdotally that's quite a bad idea because it'll make you push past your limits and mask the symptoms of HACE. Next is paracetamol, ibuprofen. You should take them in pain, ideally only on the descent, because again they can mask the symptoms of HACE or something more serious, and yeah, they'll make you push past your limit when you shouldn't. Oxymetazoline is a nasal spray which you should take if you have a blocked nose at high altitude. It can be fantastic for just maintaining your breathing at a nice rate. Cough medicines like codeine or Detus should be taken, but sparingly, because they can allow you to reduce the inflammation in your lungs from a dry environment cough, but then they can stop you recovering. Caffeine, hot take, shouldn't be taken on the build-up or during an expedition. It should only be taken on the descent from summit day. It'll block you from creating iron or uptaking iron into your body, and it'll stop you creating the much needed red blood cells. Coca leaves can be used, shouldn't really be taken. There's better medications, and you shouldn't mix them with other altitude medications, so that's why it's a bad idea. ADHD medications, they'll dehydrate you, you shouldn't take them. Imodium, you can take on a summit push to stop you from urinating. Nicotine, forget about it. And methamphetamine used to be taken, but not anymore because it increases HACE while also masking the symptoms. So that's all the medications you should take.